Hello and welcome. My name is Hilary Henly and I'm a global medical researcher for RGA Re International. I'm very pleased to introduce Dr. Jeffrey Henderson, who is an Associate Professor of Medicine and Molecular Biology at Washington University School of Medicine in St. Louis, and a former research grant recipient of the Longer Life Foundation. The Longer Life Foundation has been a collaboration with RGA for nearly 25 years, funding cutting-edge research into drivers of mortality and morbidity. Today, we'll be talking to Dr. Henderson regarding his research and the importance of funding that is helping to progress the future of medicine. Dr. Henderson, welcome, and thanks for taking the time today to talk to me regarding your work.
Thank you, Hilary. It's a pleasure to be here.
How did you initially become interested in science, and what or who inspired you to become a researcher?
My love of science, I would say, goes back almost probably as far as I can remember. I think it just stems from a curiosity about how the world works. I owe much, as many do, to my parents. I'm the son of an engineer and a nurse. I think their encouragement early on certainly was a start to that. I had the good fortune to work with a resident actually at Mayo Clinic in Rochester, Minnesota, a resident in anesthesiology who kind of took me under his wing as a high school student. And I had the opportunity to work in the lab with him. His name is Dr. Michael Joyner. That project progressed a great deal. I went on to the International Science Fair with it, and kind of had the opportunity to speak with many different scientists in many areas. With so many of these things, sometimes it's just important to feel like you can actually do something or function in a new area like that. So I give a lot of credit to those early on who stimulated my interests and really encouraged them.
Your research is focused on bacterial virulence and improving antimicrobial therapeutic strategies. So how do you see your work continuing to improve mortality and morbidity? And when do you think in the future we might see tangible improvements?
With the advent of a lot of new antibiotics, at least as of 50 years ago, we've really enjoyed a period of time where we can treat infections and prevent infections quite well. But it's maybe in the past 10 or so years where we've really seen a lot of antibiotic resistance among bacterial pathogens. And we're starting to lose some of our edge there. So I think there's a real need to come up with new ways to treat infections, to be smarter about when we use antibiotics, and in some cases to predict who needs more aggressive care early on and who's going to do just fine. So work in our lab is directed along these lines. Some of it is directed towards identifying new ways to treat infections, antibiotics that in some cases are more narrowly tuned to prevent infection by one bacteria or a few bacterial strains, rather than knocking out all our beneficial microbes at the same time. So that's a line of inquiry that we pursued for a number of years in the lab. Looking forward, I think we'll start to see more and more antibiotics like this. It'll probably, I would guess, be in the 10-year time range at this point. It's early, but we're still already seeing signs of new antibiotics that use some of the principles we're applying to identify new ways of treating infections.
What has been your most impactful discovery in the lab to date that really has the potential to influence improvements in health?
My laboratory, as I indicated, it focuses on bacterial pathophysiology. We have looked at a whole spectrum of bacteria, E. coli being among them, that I think most people will recognize. E. coli and its cousins, it turns out, have a function within them that the ones that cause infection are well tuned to do so through a special group of genes that are not carried by all E. coli or not all of its cousins. It is a group of genes carried by the bacteria that cause plague, bubonic plague actually, and we've looked more carefully at how that collection of genes works. And we've come up with new ways to prevent that functionality in the bacteria from doing things. And with that, we're starting to see that prevents these bacteria from causing infections and is perhaps a new way to treat these. We're looking at other ways that your host immune system prevents infection by restricting or making iron less available to bacteria. Iron is a key nutrient for bacterial growth, and the more your body can keep it away from bacteria, the less they can grow and cause infection. And we're coming up with some new ways to facilitate that kind of immunity. So that would be another way to kind of supercharge, if you will, your immune system and prevent or treat infections.
So are there any new directions or innovations that you envisage driving your research in the coming years? And I suppose also, how has the COVID-19 pandemic impacted your work, if at all?
Yeah, the COVID-19 pandemic came along, and it wasn't a disease, of course, and everyone can say this. It was a new disease that none of us were busy researching at the time. But like many of us in infectious diseases, we saw a big challenge coming, and it was an opportunity to work together where you saw an opportunity to improve outcomes with COVID-19. So that's something we did, getting together with a group of physicians from across the country, in this case, to try to bring online what is actually an old therapy, which is convalescent plasma, the plasma from people who have recovered, in this case, from COVID-19, and to see if we can use that therapeutically in patients who were recently infected. So that was, at this point, a 2-year-long adventure in a new area of science for me and everybody else. But I think we made an impact with that. It was one of the first COVID specific therapies available. We learned a lot about its use in those early days that is applied now. And as we saw monoclonal antibody therapies come along, many of the principles that we learned with convalescent plasma are applicable there. So I think it was just part of a large, really global effort to bring these therapies to the forefront. I am, in the past, a chemist by training, as well as an infectious diseases physician. And one thing we've used, and that the Longer Life Foundation has really supported, is using what's called mass spectrometry or small molecule profiling to identify how disease happens, to identify those at high risk of severe outcomes of disease. And when COVID-19 came along, it provided us an opportunity to very quickly approach exactly that. And we did some studies looking at COVID-19 patients at the time of that nose swab diagnosis. We collected a urine specimen, which is easy to collect in people who are infected. You don't have to send trained people to draw blood. And we used mass spectrometry to identify biomarker signatures of patients who progress to severe disease. As you well know, not everybody with COVID-19 develops severe disease. It's a minority of people who are infected. But we have a limited supply of treatments. Those treatments are best given very early on, before we know who really needs them. In this case, we applied this technology to identify people who are going to progress in a severe direction. And this is something that in the future, perhaps, we could use to identify or flag patients for early treatment. And that this general principle, of course, could be applied to all sorts of infections or other diseases as we move forward.
I wanted to ask you also regarding the impact of financial support from groups like the Longer Life Foundation in driving those pilot and feasibility research, but subsequently also securing larger grants for your work.
This is a really important point, and the Longer Life Foundation, in this case, played a really key role in bringing to the fore the more adventurous things that we would do, I would say. It seems like an obvious thing that if I had a new idea or a high risk idea, that a government grant would be the place to go. It is often difficult to get those funded early on. So it's very important to have early proof of concept data in hand to go on to get some of these larger grants. And so Longer Life Foundation has been fantastic in that regard. Has trusted us to move on these more risky projects, and I think in my case they've all been quite successful, moving on to the next round. So I think Longer Life Foundation is, at least in my case, I think is I hope chosen wisely, but I think the facts bear that out.
So one last question, which may be difficult to answer, but in closing, can you describe your hopes and your aims for the future of research in 5 words?
Healing through science and cooperation.
Fantastic. Thank you. Dr. Henderson, thank you for taking the time today to share with us your thoughts and your ideas regarding your research and how such funding is helping to progress the future of medicine.
Thank you.